you about NIPRD Research Clinic, the division under the DG's office, and also it has come a very, very long way. We're sometimes tucked away behind this building, but today we are in a new place, which is going to be opened today. And want to thank the DG COA of NIPRD, Dr. Adigwe, for the wonderful facelift you're doing to us particularly, and also to the NIPRD in general. I want to talk about NIPRD Research Clinic. It's a critical link necessary to bring discoveries of research to the market through clinical trials and attaining mandates of NIPRD, putting pharmaceutical products in the market for the well-being of the Nigerians. But today we're just looking at sickle cell disease, which is the baby of NIPRD. From the beginning, that's what brought NIPRD to the limelight. And why sickle cell disease? Because it's a black man's disease. If nobody deals with it, if nobody can deal with it properly more than a black person. So because of that, knowing what sickle cell is all about, it's a genetic disease that came on board because of genotype AS and AS meeting together to have an SS. And because of that, it's an effect on the red blood cells. So the red blood cells are hardened, they get attached together and they block the vessels, causing untold pain. It's been adding to the pain of labor. If you want to know what the pain is for these people, use a rope, tie your finger and leave it for a while. Then you understand the kind of pain, just a little bit of pain they are going through. So this is what informed me that we need to look at sickle cell. All over the years, NIPRD has done research, deep research into sickle cell. And NIPRD research has been a pivotal spot, has been the one that has gone through, has been a trailblazer in sickle cell clinical trial. And there was a time we did sickle cell clinical trial hub, where about 2,000 sickle cell patients gathered here because of a phytomedicine that was discovered by NIPRD. Because NIPRD rose to that occasion to fill that gap, to bring up a drug that can manage sickle cell and give them good quality of life. We're expecting it should be a clap to that. It was not easy to have phytomedicine during clinical trial up to the market spot. And not just that, NIPRD research is involved in writing protocols, clinical research, clinical consultation, making sure that we have a pool of patients for clinical trial. And we intervene with every technical department on research purposes. So I want to let you know that we are doing this to make sure that our patients are doing very well. So I said we're also committed to giving quality services to not just our NIPRD staff, but to the people, our environs. We give back to them those things that we are doing here, and they always come to appreciate that there's an institute here that's doing research, trying to find the best ways and quality ways of managing the patients.
Welcome address. It is to be delivered by the DGC of NIPRD, ably represented by Professor Mrs. Kunle, Yemisi Kunle. So we have the privilege to now give her the mic to speak on behalf of the people.
Thank you. Good morning, my professors. I'm speaking as a DG. My professors, the heads of departments, heads of units, staff of NIPRD, invited guests, people from our neighboring villages around us, ladies and gentlemen. It's my honor to be here. I'm Professor Yemisi Kunle. I'm standing in for the DG, Dr. Adigwe. I bring warm greetings for him. He would have loved to be here because it's a maiden health week for the institute. But then you have to make do with me. I hope I will do a good job. So just as the coordinator has said, Dr. Epeyon, she has introduced what is going to happen. We're focusing most especially on sickle cell disease. It's a health week, and we all have to be healthy to take healthy strides. If you are not healthy, then your strides cannot be healthy. Sickle cell, yes, was a healthy stride we took long time ago, and we're very happy that the strides are getting bigger and bigger. It's reaching far and wide, even outside the shores of this country. We have a product already that is used for the management of sickle cell disease, and a lot of people are benefiting from it. Dr. Kenyon talked about the antenatal services. That would really be nice, especially it will help to reduce the maternal mortality rates. Yes, some of us, because we now have the antenatal clinic in the institute, maybe we will try to do a mistake or a last card. So I will say that to the DG. The message I will tell the DG that we have antenatal services now. So he may want, or some of you may want to use the services as time goes on.
And now we are coming to the main deal for today's occasion, the keynote address. It will be delivered by an enforcer of scientific correctness and a man who is so proud of our pharmaceutical profession, above all his ideological toughness. Professor Martin Adigwe, you are not new to us. Please.
When the Wambebis, when the Gamanians, when the Kunles, when the Ubuduzes, when the Babas took Samuel, when the Abayomis, when the Orders, when those people I met as a kid, when they did like Nisan, they did not cross the border of Ghana. In fact, the only person who was traveling was Wambebi. The only person that I met traveling in this history was Wambebi. Because he said that he was in Maryland, or he was in Boston, or he was in New York, or he was in one country or another. Every other researcher I saw them sat here in the lab. 9-10 p.m. they were still in the lab, here in this institute. That's how they did my research. But today, even interns and compass that we have in this institute, we send them abroad to different countries. And I will show you examples. In fact, 2 compass who entered this compound last year are already on their way to US. In fact, one is already in US, and another one is on her way to UK. Compass. Therefore, we have no reason not to do 9%, 2, 9%, 3, 9%, 4, because we now know and we are more informed. What is the problem? Don't give me the answer. Your answer is correct, whatever you think it is. Sickle cell disease is far more prevalent in Africa, where patients have less access to resources. Medical treatment and facilities and the consequences of the disease are devastating, no doubt about that. As we move forward, we must continue to focus on therapeutic approaches that go beyond the current. I love this and I always quote it. The man who farms as his forefathers did cannot produce much food, no matter how rich the land or how hard it was. Look, Dr. Adigwe, the research clinic, all heads of departments, all research fellows in this institution, if we continue to farm the way Wambebe, Kunle, Gamade farm, no matter how hard we work, look, no matter how rich NIPRD is, look, there will be no good result, there will be no better result. We will continue to get the result of Wambebe and Gamade's time. Thank you.
Well, I've seen a lot here, so we can always rub minds, and you could too, and always help us. So the first question is, how does most patient look like?
Basically, in the paper on ground, how does sickle cell disease patient look like? I know that most of us have had an encounter with sickle cell disease patients, but I want to start from the beginning. The sickle cell disease patient, most of the times, does not know that